This portion of CardioSource Video News is brought to you by Medtronic.
Welcome back to CardioSource Video News. I'm Dr. Randy Martin. Continuing with the theme of looking at developments in stent technology is the ISAR-TEST-4 Trial. This study evaluates the 2-year clinical and angiographic outcomes from a prospective randomized trial of everolimus-eluting stents and sirolimus-eluting stents in patients with coronary artery disease. Dr. Vasilis Babaliaros joins us with the latest.
I'm here with Robert Byrne from the German Heart Center in Munich, and he's just done presenting the ISAR-TEST-4 results, a very exciting study comparing 2 drug-eluting stents. Robert, can you tell us a little bit about your study and what you found?
Yeah. Well, the focus of our study was to compare the outcomes of patients treated with the everolimus-eluting Xience stent against those treated with the sirolimus-eluting Cypher stent. And we think this is an important question because although the everolimus-eluting stent has shown very promising data, most of it has been in comparison with the Taxus stent. And there seem to be significant differences between the Taxus and Cypher stents.
Can you tell us a little bit how the trial was designed?
Yeah. The current analysis was a 1-to-1 randomization of everolimus-eluting stent patients against sirolimus-eluting stent patients, and it was conducted in the larger setting of the ISAR-TEST-4 trial, which was a comparison of 2,600 patients treated with biodegradable polymer or permanent polymer. But in this current analysis, we're focusing just on the comparison between Cypher and Xience.
Were there any specific lesion types that you were testing?
This was an all-comers patient design where all patients presenting with coronary stenosis and symptoms or signs of ischemia were eligible for inclusion. The only key exclusion criteria were patients who had disease in the left main stem, as these were enrolled in a ISAR left main study.
Great. So tell us about your results now. What did you find?
So basically, we looked at a clinical composite endpoint of cardiac death, target vessel myocardial infarction, and TLR. And we followed the patients now out to 2 years, and what we found is no significant overall difference between both treatment groups. So regarding the primary endpoint, we had a rate of 16% with the everolimus-eluting stent and just over 18% with the sirolimus-eluting stent.
Can you tell us about your Plavix strategy and the safety between comparing the 2 stents?
Yeah. In this trial, we had a recommendation for dual antiplatelet therapy for 12 months following stent implantation. And if you look at the safety outcomes, actually what you see are overall pretty low rates of stent thrombosis in both groups. Using the ARC definite probable stent thrombosis definition, we saw 1.9% with the sirolimus-eluting stent against 1.4% with the everolimus-eluting stent. And interestingly, if you look at just definite stent thrombosis on its own, what we saw was that the rate of stent thrombosis with the sirolimus-eluting stent was 1.4%, and with the everolimus-eluting stent was 0.6%. So a numerically lower incidence with the everolimus-eluting Xience stent, but these differences, of course, were not statistically significant.
Okay, there you have it, a very important study from here, TCT. Thank you very much.
Medtronic proudly introduces Integrity BMS, now available in the U.S. Visit MedtronicStents.com for more information.